in any capacity I can, but more from a nutrition standpoint. So the topic today was gallbladder, correct?
Right.
All right. So how many of you actually are here because you're really concerned about gallbladder issues? Because that helps me. Okay. So whether you still have it or it's already been removed, sometimes people have side effects. So if you're concerned maybe there's a problem with your gallbladder, you might be having side effects that could be related to when you eat, could be even when you don't eat. If you've already had your gallbladder taken out, the biggest complaint we get sometimes is, well, I have symptoms or different experiences when I eat. By no means am I an expert when it comes to diagnosing gallbladder disease and ultimately whether or not something should be treated surgically or not. If you're having some weird symptoms and you're not sure if it's gallbladder, I can share with you what are some common signs of gallbladder discomfort. But as I read these off, you're going to realize these could be from a whole host of different problems, right? Pain or tenderness up under the rib cage, particularly the right side, is sometimes an indicator. But then it gets pretty general from there. Sometimes some people actually may complain about a little pain in the shoulder blades, gas and bloat, which could be related to eating or not. Fatty stools. So some people say my stools are different. Maybe they are or aren't having pain, but there is a kind of a fatty oiliness to their stools. Other people say my stools look lighter or almost chalky in color. And I'm seeing some heads nod, so maybe somebody had that experience during a gallbladder attack. Sometimes it's just a feeling of fullness. And for some people, if they're having significant bloat or some pain, then you might have them complain of nausea. Now, if you're having an actual gallbladder attack and you're ending up in the emergency room, it could be significant pain. It could be nausea and vomiting associated with that. So I just thought, if you weren't sure, could it be an indicator of gallbladder and you're having symptoms like that, don't hesitate to talk to your primary care physician, because a lot of those, it could be from a lot of other things, right? But I at least wanted to share those with you. Help me out. What were some things you were hoping to get out of your talk with Dr. Lane today? What
Are
were
there
some of the most
certain
important
foods
things?
that affect your gallbladder and can cause a flare up?
Sweet, that's the one thing I can help with. I'll pay you later. Are you talking about if you still have your gallbladder or no? Yeah. Okay, so perfect. We may need some extra copies of this, but I will start passing it around. Will you guys do me a favor and just kind of start passing in either direction? Now keep in mind I had 30 seconds notice. So I have pulled this. We skipped just
Thank you, right.
in here.
Right.
So this actually comes directly from the Academy of Nutrition and Dietetics. So it's a pretty boring, basic handout, but it does go over a couple of things in terms of nutrition for gallbladder. So I'm going to give you all a chance for these to get passed around, and then we'll kind of look at it and talk about it a little bit. All right, how many am I missing? 1, 2, 3, 4. Do you know, hey, how close did we get? We have enough to make it through? And I can make copies. Okay. So basically, if something's going to cause distress in terms of nutrition or what you're eating in the gallbladder, it's really going to kind of fall into two categories. Usually it's something too fatty or something that's causing too much gas and bloat. And we can go through some of those things, but it's a little bit individualized. Number one thing I usually get complaints about is if I ate something greasy, then my stools seem to go right through me. Now, I will tell you, over time, your body does sometimes seem to adapt. Not everybody, But a lot of people, over time, the body adapts and it can handle a little bit more. So what's the next question I get? How much fat is too much? There's no answer for that. It's very individualized. I can't say you can only eat 10 grams a day or you can only handle so many grams per meal. It's a little bit of a trial and error. If I could give you a ballpark, 50 grams of fat a day is considered a low-fat diet. Both professionally and personally, I would suggest you don't do all 50 grams at one time. I'd space that out a little bit throughout the day if I were you. And you may find you can only handle a little bit less. You know, if you broke that down, that's really probably only averaging out to be about 10, 12 grams in a meal. That leaves you, around 8-ish grams to play with in a snack. But it's just a ballpark, okay? You were gonna ask a question. I didn't mean to cut you off.
Oh, you're fine. I need to know, should you change your diet after it's been removed?
Yeah, most people find they need to follow a lower fat diet, at least for a while. And like I said, years out, I talk to people and it's like they're back to being fine with everything. Others will tell me if they eat something fried, it's going to wreak havoc on them.
If I eat anything, I got struggle with.
And it doesn't matter what food group. No. So in that situation, I would always say go back to your provider, because the first thing you want to figure out is that still related to the gallbladder or is it something else? And some people really do benefit from just doing smaller, more frequent meals. And that may be an option, is if I take what I like but eat a smaller amount, doesn't run through me. Because if not, you may find that smaller, more frequent meals is a little bit easier on your digestion. So, alright, so what if you're not a big label reader? What if you like to go out to eat a lot? How are you going to know how much fat is in something? Everybody hold your thumb up. Your thumb is about what a tablespoon of food looks like. That's generally accepted as about a serving of fat. So here's my tablespoon. Here's my thumb. Pretty close, right? That's going to be probably about 9 grams of fat. If we're talking about cream cheese, sour cream, a tablespoon of salad dressing. So that's kind of a good gauge if you're talking about adding fat to your meal. Now, there are 3 common things that we eat in the fat category where that serving size shrinks a little bit. And that serving size would shrink to a teaspoon. So hold your thumb back up and bend it from the tip to that middle joint. That's what a teaspoon of food looks like. Ladies, if anybody's got a long, beautiful nail, it starts at the thumb, not the nail. All right, so here's my little teaspoon worth of fat. If I bend that over, pretty close to the tip, right? So that thumb's a pretty good gauge for a tablespoon versus a teaspoon. All right, this dinky amount of fat right here would represent 3 types of added fats to our meals. Mayonnaise, butter or margarine, and any kind of cooking oil. So I know that there's a lot in the media about choosing a healthy cooking oil. I still want you to choose healthy fats, but just recognize if you're talking about does it impact my gallbladder, is it giving me symptoms, your gallbladder doesn't care a whole lot whether it was a healthy fat or an unhealthy fat. It's usually the total amount that's going to cause distress if it's something that's causing you problems. So if you're a mayonnaise fan, that's not a whole lot for a sandwich, right? But with the mayonnaise, the cooking oils, and the butter or margarine, that's still about 9 grams of added fat. So you put 2 pats of butter or margarine from McDonald's on those pancakes, you've probably added 15 to 18 grams of fat to that breakfast. And that doesn't include what's already built into things, right? Like biscuits and pie crust and French fries. Yes, ma'am.
Do you advocate margarine over real butter?
So if we're talking about gallbladder, I don't think it matters because it's a total fat that's probably going to have an effect. If we're talking about overall health, heart disease, if you can get a trans-free margarine. So, trans fats are kind of the fat that we created when we made stick margarine, without trying to get too scientific. And it kind of has a double whammy when it comes to heart disease, a negative impact. So if you can find a margarine that says it is free of trans fats, and it usually will say trans-free, I would still bet that that would be a better choice.
Than butter?
Than butter. Yep.
I love butter.
Well, and if you like it and you don't have issues with your cholesterol, I'm not saying you can't.
Oh,
Look, it's
yeah.
all about volume, right?
That's
If I
what
use a
I do, yeah.
little bit here and there, I'm probably
I'm
fine.
not going to.
Butter is an animal fat, which means it's a saturated fat.
Oh.
So if there are concerns that you're getting too much saturated fat in your diet, or your doctor has evaluated your cholesterol or your heart condition and feels like you need less saturated fat, butter would be a saturated fat, meaning it's a little more prone to being artery clogging. And that's really where the debate for butter versus margarine stems from. Yes, ma'am.
On the tablespoon of fat, you mentioned cream cheese, I forgot what the other things you mentioned
Almost
there.
any but the three that I just mentioned are by the teaspoon. But I can give you some more examples. Sour cream, salad dressings. Now we're talking full fat or regular salad dressing. If you're choosing a light one, it's going to have fewer grams of fat. I would put cheese dip into that category. So those of you who like to go to Mexican and get that white cheese dip, I'd put that in that category. Yeah, not very much, is there? I can't really relate it to your hand, but you know, when they bring you those little dinky cups at restaurants or the little packages of salad dressing, that oftentimes is the equivalent of about 4 tablespoons or a fourth of a cup. You know, a fourth of a cup. The way I remember it is a fourth, you got 1 over the 4, right? That 4 represents 4 tablespoons of whatever it is, whether it's water or milk or cooking oil. What other questions can you guys think of, whether it relates to fat intake or gallbladder disease?
Is olive oil any better? I mean, is it better to use olive oil to saute and stuff? Or is that just another fat?
So, and if we're talking about gallbladder, again, probably not a significant difference. But if you're talking about, is that a healthy fat? Is that a better fat to choose if I'm going to use some? Yeah, that is a healthy choice. Right.
I use extra virgin.
Yep, good. That's a fine choice. Yes, ma'am.
I will say, as far as my own personal experience of trying to combat a gallbladder attack, the best thing that I've done is I have hung a poster board behind my closet door, and I have a can eat and a can't eat. And it's trial and error. It really is. It's a personal experience. Like, I can go and have a gyro, but I can't have the tzatziki sauce because cucumbers set me off. So it's a big give and take.
Yeah. And who knows, it may be that cucumbers are just make her a little more gassy and bloated, because whether fat bothers your gallbladder or not, anything that makes you feel more gassy or bloated sometimes can be a little more troublesome for people. And it's individualized. I mean, that was really a good tip to share. That would be true for a lot of kind of gastrointestinal disorders. Is sometimes you just have to be diligent and keep a little notebook or a poster, and when something sets you off, write down what you ate. And if you know, it may be one of those things where you have to try it one other time in a situation to see, was it actually the tzatziki, was it actually the cucumber, or was it just coincidental?
Especially when it's one of your favorite things to eat. You try it about 4 more times and then realize, no, you can't have that anymore.
Yeah.
Don't look for relief though, because since I had my gallbladder out, I loved cucumbers and melons, and they all killed me since,
Yeah,
before
Yeah.
I could eat them.
I still have mine, but
What else? Anybody else have a gallbladder experience they want to share with the group?
Yeah,
We
how
all
about
like to
having
relive those.
How about having misdiagnosed as a heart attack?
Well, you know, you raise a good point. I mean, when somebody is having a severe gallbladder attack, it can be extremely painful. And where those pains can occur, potentially up under that rib cage or between the shoulder blades, you know, I can see where that would be concerning for a heart attack. Yes, ma'am.
Yeah, I had like 3 attacks in a row, like 3 weeks in a row. And it usually was after a fried, heavy meal, and usually in the middle of the night, and it was a pain that was like right here. So I knew it wasn't a stomach ache and it wasn't the heart, but it was the gallstones were blocking the
That's what
entry.
mine was.
And so I went to the emergency room, I think twice, and then the 3rd time did surgery.
That's got time
Had
to
it
come
all.
back.
I know.
Take it out and get it right
Take it
again.
And are you glad you had it out?
I guess so. It's been about 20 years now, so.
All right, so some of you all know that one of the roles I have here at the hospital is I coordinate our bariatric program, which is kind of a big word for people that elect to come in and have weight loss surgery. So even though you may not be planning on having weight loss surgery, I will tell you one thing that a lot of people don't know is you have rapid weight loss. You are at risk for having a gallbladder attack. Oftentimes when somebody, if you ever have
I
a
gotta worry about that.
But, you know, it's not uncommon if people are having weight loss surgery to get, they have the offer to sometimes go ahead and have their gallbladder removed, even if it's perfectly healthy, because they have a much greater risk for having gallbladder disease while they're rapidly losing weight after surgery.
Well, I still have part of mine.
Do you?
They said they couldn't get it off. Everybody told me that was weird, but he said he couldn't get it off, and then I still had part of it. Cause I had to go home with a tube hanging out of me for 2 weeks.
Yeah.
Is there a good way to have rapid weight loss without the surgery?
Yeah.
I love that.
Yeah, I'll be honest, when it comes to weight loss, I'm a big fan of it being a little bit more slow and steady. When you lose it rapidly, you're going to lose some muscle. I mean, that's the reality of it. Even the people that are having weight loss surgery and are under a strict program, you lose quickly. Your body is trying to create enough calories, and if it's not getting enough from what you eat, chances are it's going to tear down some of your muscle to create an energy source. So, you know, the first week to 2 to 3 weeks, if somebody's losing a little bit fast, I don't worry about it too much because sometimes that's water weight. After that, you normally would want it to be 2 pounds or less per week. But it's more likely to stay off and more likely to be fat loss.
Yeah.
I can't even lose that.
Now, what if you still got your gallbladder and don't have a problem? Why not go ahead and have it taken out so you won't have a problem later?
Because your gallbladder plays an
Preventive
important role.
maintenance.
Yeah, what a good question. But look, y'all, if you got your gallbladder that's working fine and you're hearing all this and you're thinking, I need to just go get that sucker out. The gallbladder plays an important role in digestion, including, well, it does play a role in fat digestion, which is why so many people, once they get it taken out, they don't digest fat as well. Because they're otherwise having to learn not to use what that gallbladder was intended to do. So yeah, if it's healthy and you can keep it,
So what's the gallbladder intended to do?
well, so that's where you wish Dr. Lane was here.
Well, I'm not your friend like him, huh?
Then we're gonna talk bad about it.
Nah, we don't want to talk bad about him. We're actually very fortunate to have him as a new addition to.
Okay.
Bye, thank you. We're actually really fortunate to have him as a new addition to Clearview. I'm
So is he
quite.
gonna do this class again?
I will find out. As many of you know, Emily is not currently here. Stephanie over in administration is helping coordinate some of this until Emily gets replaced. So I will pass along to her that there's been some interest in maybe trying to get him back in here, even if it's maybe for a couple minutes at the beginning to answer things that my little brain couldn't answer. If he has a PowerPoint presentation put together, maybe we can see if it's an option to have that available for you guys or something like that. So I will certainly pass that along. All right, so I know I kind of came in, you guys already finished the meal, and so I don't want to keep anybody too late. I don't, where are we at on time? So it's 1 o'clock. if you guys have questions I can answer, you are welcome to stay behind and ask me. But I want to be respectful of your time. So if you're at a point where you're done eating and you feel like you've gotten out of what I could provide today, you're welcome to go ahead and go.
I wanted to get out there.
Okay. Okay.